Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Dale City, Virginia at Hanania Dental, discussing the latest advances in dental implants and how they can give you the healthy and beautiful smile you've always desired with one of this area's top implant dentists, Dr. Hannah Hanania. Dr. Hanania earned his Doctor of Dental Surgery degree from the University of Maryland, graduated from the Mish International Implant Institute, and was awarded a fellowship from the prestigious International Congress of Oral Implantologists. Dr. Hanania is a member of the American Dental Society and the Virginia Dental Society, among others. Welcome, Dr. Hanania.
Thank you. It's great to be here.
Oh, it's our pleasure to have you on. Your first time, in fact, on A New Me.
Yes, it is, and I'm so glad that you're doing this and that you're interested into dental implants, which has really been a landmark in dentistry. It's been changing a lot of things that we've been doing for centuries now with the introduction of dental implants in the field.
And that's why we have you on today, Dr. Hanania, to educate us and enlighten us on this very important topic. And on that note, I'd like to begin by asking you if you can please tell us what dental implants are.
The easiest way of saying what dental implants are is basically to say it's a replacement of basically root therapy replacement, which means the root of the tooth, replacing it by something. In this particular case, we're talking about the mix of metals, mainly titanium, and basically we put the metal inside the bone and then the bone grows around it, and that replaces the root for us. For years, we've been able to replace the top part of the tooth, which is the crown, but now we have a way in which we can replace the root of the tooth. The main advantage of the dental implants and the tooth replacement therapy is basically now we don't have to damage the teeth around it in order to get a replacement. In the past, when we're doing any replacement, we used to do bridges or dentures, and in these cases, we used to put too much pressure on the adjacent teeth, and in many cases, we have to basically destroy them by cutting them. But with dental implants, we replace the root and then put the crown on top of that, and that doesn't cause any damages to the teeth next to it. Actually, the opposite is true. When we're doing that, we're basically shrinking the bone, and the patient is able to keep their bone for a long time. Usually, after you lose a tooth, you start losing the bone as years goes by. And that eventually could cause some facial changes and a lot of basic decoration in the skin and so on. But when you put the implant there, you maintain your jawbone, and in addition, you maintain all your facial muscles and expressions and so on.
So in other words, based on what you just said, Dr. Hanania, correct me if I'm wrong, please. My impression is that not only do dental implants, can they fix health-related issues regarding the bone and those areas of the mouth within one's mouth, but also from an aesthetic perspective, they can enhance our smile and make us feel that confidence again that we used to.
Correct. Actually, the main difference is you see it like, generally speaking, as we age, we kind of tends to lose this vertical dimension here. And what does that cause? It causes a lot of basically shrinkage here. But however, when you do the dental implants, you don't lose the bone, and so you keep your skin and your vertical dimension as is, so that doesn't happen. And basically, yes, I mean, if you look into the past, you can see a lot of people who lost their teeth, they kind of, this is shrink and makes them look older. Or with the dental implants, that kind of avoid that problem.
Well, that's certainly very good for us to know. Now, who's a good candidate for dental implants?
Basically, dental implants are replacing missing teeth. So anybody who is missing teeth is a good candidate for dental implants. There is a very big variety of what can dental implants do. They can help people who are missing all their teeth. They can help people who are missing one tooth or anywhere in between. In the old days, there used to be a lot of myths that people with diabetes or smokers or others cannot get dental implants. In reality, most research doesn't show that there is much of a difference as long as it's managed correctly. So as long as your doctor is managing it correctly, it doesn't make a difference in your medical history. They have to be aware of it and they have to manage it, but other than that, pretty much everybody can get the dental implants.
And certainly benefit from them.
Definitely. I mean, the benefits of dental implants are tremendous. I mean, people, especially who are wearing dentures, when they get the implants and that allows them to keep their dentures or plates in place, I mean, that means a world difference for them. They no longer has to worry about it basically not staying in, about public embarrassment. They can chew much better because now their teeth are staying in all the way, so they can chew on them, and also they can talk better because now they don't have to worry about it moving, so they're basically the words would come out pronounced correctly. So yes, a lot of people would benefit drastically from them.
Now, just so we can get an understanding of what a patient would be typically looking at, Dr. Hanania, regarding the dental implant process, can you please tell us about that?
Sure. Now, the most important thing with dental implants in order to get success is to basically have a good background, and that means to have a good bone. And many times people don't have bones. Luckily, at this time, we have a lot of ways in which we basically can grow some bone. It's much harder to grow bone than if we have it, so that's why if anybody's losing a tooth, they should definitely ask their dentist to kind of replace bone for them the day they lose it. It makes a huge difference if you get it done right then than to have to wait until after. You kind of save yourself so much work, so much effort, so much surgeries, in many cases so much money too if you get it done from the beginning then versus getting it done later. After getting the bone done and having it ready, all what we have to do is just place the metal piece inside the bone, which is a very simple procedure. It sounds so much worse than what it is, and it sounds painful, but in reality that's not true. As you can see during the surgery, that basically placing it in the patient is kind of comfortable and not that uncomfortable. Yes, you have to get numb, but that's about it, just like getting numb for any filling.
Exactly, and speaking of the procedure, I believe you have a procedure that you'd like to show us?
Yes, basically procedure we did on a young lady, and as you can see the tape, it's 20 minutes procedure.
We're now going to see Dr. Hanania perform a dental implant procedure.
There's a lot of people who think dental implants are a very complicated procedure and a very painful procedure. That's not the case most of the time. Pretty much you have to get numb in order to do the procedure. Just like if any of you had a deep cleaning or had a filling done in the past, you have to get numb just the same way. And then after getting numb, we basically do the modifications on the tissue that needed to be done and place the implant inside the bone. Again, this sounds like it's something complicated, but in reality it's very simple. It could take around 20 minutes, half an hour to do the procedure in most cases. And basically after that you're gonna leave with some sutures or stitches on there and have to come get them back out in 10 days. Most of the time it's easier to do an implant than actually doing a filling.
We're now back with Dr. Hanania. I must say that was some procedure that we just saw, and like you had mentioned earlier, Doctor, it didn't take long at all. You're only talking about 20 minutes or so to have this taken care of.
Right, and generally speaking, that procedure was not very well prepared as far as the implant side because the patient had been missing a tooth for a while, and when she lost the tooth, she did not have bone placed there. So that made it a little more challenging. Other procedures could sometimes even be less than that. But overall, the procedure went well. The placing of the implant, as you can see, it's very, very simple. And in many cases, as I said, it's simpler even than doing a filling itself. And the patient is doing very fine. I mean, she really didn't feel anything. Even the initial injection, she did not feel it. And now she just had to follow some home care instructions, and she should be fine going back to work tomorrow.
What kind of results can we expect from dental implants?
One of the nice things about the implants is if the implant is integrated in the bone, that means if the body accepted the implant. And now we're talking about 9 out of 10 the body accepted. There is 1 out of 10 that the body doesn't accept, and that's something we find out early on in the procedure. But then afterwards, if that works, at this time we're talking about 97% success rate in 30 years. And that's pretty something unheard of in dentistry. Like if you talk about fillings or crowns or things like that, generally speaking, if we get 10 years of them, we consider it very luckily. So that's a really, really high success rate compared to other procedures in dentistry.
Yes, indeed. That's why we're so happy you're letting us know about this. That's great for us to all know about.
Thank you for giving me the opportunity.
Now, how long do these results typically last? What are we looking at as far as the durability and life cycle of these dental implants, Doctor?
Now, if the body accepts the implants, and basically 1 out of 10 get rejected, but 9 out of 10 are accepted, we're basically looking at a 97% success rate over 30 years.
Over 30 years?
Yes, over 30 years.
Basically, it's for life then if one is, let's say, in their 40s or 50s and having a dental
implant. Pretty much, it is for life. Now, taking care of an implant is definitely something just like a regular tooth, if not more, because you could have, you're not going to get a cavity in an implant, but you could get a gum disease in an implant.
Sure.
So you definitely need to make sure you take care of the implant, just like you take care of your regular teeth. But yes, you should be expecting it to last for a very long time.
Now, are there any follow-up visits, Dr. Hanania, that were required after, let's say one comes in, has a dental implant procedure? Because you mentioned earlier that this can literally be done in 20 minutes or less, so one can do it conceivably during their lunchtime if they want, come back, you know, have this done, leave, go back to work, and then as far as follow-up visits, what are we looking at?
I usually don't recommend during the lunchtime because we wanted the patient after that really to kind of take the day off and just relax, even though it shouldn't be such a big deal, but it would be nice for them to get that. Also, it usually takes us much longer to prepare than it is to basically do the procedure. So even though it is 20 minutes, probably the patient been here half an hour before we started just to get all the records correctly. Usually we want to see the patients 2 weeks after to remove the stitches, and then we follow up once a month until the bone is mature and accepted the implant, and after that we place the crown on it, and then after that we do just a regular cleaning recall appointments, and that varies between 3 to 6 months depending on the patient condition.
Now we've only got a few moments left, doctor, and I wanted to ask you before I let you go, yourself and your practice, Hanania Dental here in Dale City, has developed a very strong reputation as being one of this region's top implant dentists. And I wanted to ask you what separates you and your practice from so many of the others around here?
I think the key thing is my staff. I work with a very, very strong team. Most of my staff are very well educated on the issue and they know exactly what they're doing, and we have a very strong working relations in the office. I think that makes the environment extremely nice, extremely easy to work with, and makes our patients very happy. Because going to the dentist, I mean, let's be honest, nobody likes to go to the dental office. So I'm sure most patients don't come here very excited. But then really when they deal with a very welcoming staff, they tend to make their experience much better and makes the overall experience much better. We tend in the office to do a lot of continuing education courses, and we manage to do it for the whole staff so that everybody is on the same page, keep us all in the same communication. And I mean, I'm really, really proud to have such a strong staff that's very committed to basically the patient's comfort and taking care of the patients. I think many of my patients really like that, and that's what makes the environment in the office very friendly and very nice to work in. I mean, it's one of these things that you really want to go to the office because you're really working with very nice people.
Well, you know, that's what we've actually heard in our research, that you really care about your patients, doctor, you and your staff, and that says a lot in this day and age. And on that note, I'd like to thank you for joining us and being a guest on A New Me.
Thank you for having me.
It was our pleasure. We'd love to have you back in the future.
Thank you. I'll be honored.